Sometimes the tooth hurts, but there's a lot that we can do to ensure that our pearly whites stay healthy. Here's our Brenda St. with a segment on Dental Health Month.
Hello, with me today, very pleased to say, is Dr. George Limanzakis, and he is a dentist here in town with Seaway Family Dental, and April is Oral Health Month. And I would like to ask you, Dr. George, why is good oral health important to us? With every, with our general health.
Well, Brenda, oral health is very, very important at any stage of life, because we use our teeth to smile, to speak, to laugh, from the time we're really young until many till we get much older, of course. And so it's also important because it allows us to interact with other people much more comfortably. A lot of people are very self-conscious.
Yes.
There's a lot of people that come to the office, they talk to me and they cover their mouths, they're very embarrassed, they feel ashamed. They don't have to be, but that's how they feel, and they probably felt like this for a very, very long time. Other people, they get together with their families and they don't smile, they don't show their teeth when they have pictures or family portraits, and it bothers them. And so people come to see me because of that as well. The other reason oral health is important is because a lot of times if you're not comfortable with chewing your food, you won't digest your food properly either, and then you can end up having stomach or intestinal problems as well.
And it's probably good to chew your food a lot too.
That's right, yeah.
And what conditions, well, I mean, I think we did kind of mention that the connection between good dental health and overall health, because as you say, it can, because if you don't have good dental health, it can affect other areas of the body. But what conditions can be linked to poor dental health? Is there a particular?
So you can have a bunch of different conditions. We'll just name a few just to kind of do
well, just to mention some of them, because there's many. Right.
So there's something called endocarditis, which basically is inflammation around the lining of the heart, and you can actually have have bacteria that enter the bloodstream from the mouth, go into other areas.
It can be very serious. It can be fatal in some cases.
Yeah, it can be. And it can go into, let's say, the lining of the heart or into a valve of the heart and create damage. And you have, something called rheumatic fever as well. There's other conditions in pregnant patients. We see often something called pregnancy gingivitis, where due to the hormonal changes the pregnant woman goes through, the reaction of the gums to the plaque causes a lot of bleeding. And also some of the areas of the gums can develop what we call pregnancy tumor, which is basically a bigger mess of gum, very uncomfortable, bleeds every time you brush it, and it's something that will have to be removed at some point if it doesn't go away after the. So,
in other words, it's very important to look after your teeth and to make regular visits to the dentist to make sure everything is fine, and medications or certain diseases affect your dental health too, and I think we kind of touched a little bit on that.
Sure. Some medications that I can mention cause dry mouth. There's antidepressants.
Oh yes,
there's,
yes.
Very, very important. Very important. There's some medications for blood pressure and antidepressant. They cause dry mouth. The dry mouth can cause cavities. It becomes uncomfortable. Some people have bad breath because of it. And then there's also the conditions. Some people have cancer, so they're treated with either radiation or chemotherapy. They can have mouth sores or ulcers, and that's very, very uncomfortable as well.
And also, your diet is very important. We can just touch very briefly on that because we've got a couple of other areas that we want to mention. But your diet, like try to stay away from, I guess, sugary drinks.
Right. The starches. We always think of sugar, but starches as well. Chips contain a lot of carbohydrates. Starches. They have a tendency to stick on the food, but definitely anything that's whole, like fruits that are whole fruits rather than juices, are better. What we encourage people to get is a healthy, balanced diet where you get vitamin C, vitamin D, calcium, and even the vitamin B vitamins as well, which will end up helping in the support of the teeth and the gums.
It's very important. And also, dentists can be first, this is Oral Health Month, and being, of course, April is also Cancer Awareness Month, but they can, you can be first responders. Like when they go in, if you see something suspicious in the mouth.
Absolutely. Absolutely. So a lot of people don't realize this, but a lot of times when you go to see your dentist, you'll end up having an exam. So sometimes it's called an oral cancer screening exam or just a screening. And what most dentists will end up doing, maybe they don't tell you, but they'll end up looking to see if there's any lumps, bumps, to see if one side looks the same as the other, if there's some red or white areas that are unusual or don't look normal or that weren't there before. And so
I think you
that's
said there's probably someone that you do have or you can have at your office, eh? that
right,
can-
right. In our office in particular, we have a specialist that comes in once a week, and you know, he does biopsies among other things as well. And you know, we have picked up on a few people, unfortunately, some bad things that you know.
Yes, unfortunately, but
treated.
yeah, I know, because apparently oral problems like cancer problems can be quite problematic, I guess. That's why it's
Absolutely.
good if you could. And also, we want to mention that I believe it's going to be June 9th, Dentistry from
Correct.
the Heart.
Right, right. Dentistry from the Heart. It will be
Started
June 9th.
you started it,
Right.
but other dentists have taken it on.
That's
It
right,
started
it's-
in the U.S., I think, though.
It started in Florida, absolutely, and then it traveled through many different states, and it's made its way through through Canada. I did start this with my staff about 6 years ago. I think it was 2012, and it's nice to see that there's been at least one other office in Cornwall that has also implemented dentistry from the heart in their
Yes,
office.
yes.
And so, you know,
That's a good thing.
Yeah.
And it's for people 18 years.
it's usually for 18 and
older.
older, exactly, because kids are treated, or
Yeah.
they seem to have social programs for underprivileged
Yes,
children.
they do, apparently,
And
yes.
so we try and do this one day out of the year where we do see patients 18 and over, and we provide free dental care for them.
Oh, and I imagine you must be busy.
Oh, absolutely, absolutely.
Okay.
We've treated over 380 patients
my
so
goodness.
far.
Well, listen, it's been a pleasure having you,
Thank you very much,
Dr.
Brenda.
George, and I know that will be successful again on
Thank
June
you.
9th, and Oral Health Month. Got to look after
Thank you very
our
much.
health.
Thanks for having me.
You're welcome.